The double doors open. A nurse calls a name, not theirs. Zara's daughter shifts beside her, holding her arm against her chest. They have been here 53 minutes. Zara knows this because she has been watching the clock the way you watch a clock when you cannot do anything else. She left work early. Her manager said it was fine in the voice that means it is not entirely fine. Her daughter's arm might be broken. That is why they are here. Zara looks at the form. Name, date of birth, insurance card. She handed it over. The woman at the desk took it, typed something, handed it back, said nothing about cost. Zara almost asked. She didn't, because she has asked before, at a pharmacy, at a clinic, and the answer is always, it depends. It depends on what they find. It depends on who reads the x-ray. It depends on things only a letter will tell her, weeks from now, from an address she doesn't recognize. She has a $2,000 deductible. The first $2,000 of tonight is hers. She doesn't know what tonight costs. Nobody in this building will tell her. The double doors open. Her daughter's name is called. They walk through together. Behind them, the waiting room continues. Other people, other Tuesday nights, other unanswered questions. What Zara just walked into is not a gap in information. It is a feature. 100 million Americans, 41% of all adults, carry medical bills they cannot pay. Medical debt is the leading cause of personal bankruptcy in the United States. 66% of all American bankruptcies trace back to medical expenses. Here is what almost nobody says. Medical debt was not always this way. It was engineered, in a specific decade, by specific people, for specific financial reasons. And in January 2025, the Consumer Financial Protection Bureau, the government agency created to protect ordinary people in financial markets, finalized a rule that would have helped 15 million Americans by removing medical debt from credit reports. Debt collectors sued. The Trump administration sided with the collectors. A federal court vacated the rule. The watchdog muzzled. Again, the same story we covered in episode 6. The question is how we got here. The answer does not start in a hospital. It starts in a boardroom. For most of American history, hospitals were charitable institutions. Unpaid bills stayed on the books. Illness was not a choice. Debt from illness was not the same as debt from consumption. That ended in the 1980s. Reagan-era cuts reduced federal funding to public hospitals and slashed Medicare and Medicaid reimbursement rates. Hospitals, squeezed between rising costs and falling revenue, had to choose between charity and survival. Hospital executives said explicitly in trade publications at the time, "The era of lenience is over. We are going for the money." The tool they reached for was the third-party debt collection agency. By 1993, according to the American Collectors Association, hospitals were the largest source of debt collection business in the United States. Patient debt became a tradable asset. Hospitals sold portfolios of unpaid bills to debt buyers, companies that bought debt for pennies on the dollar, and pursued patients for the full amount plus interest with every legal tool available. A broken arm, an emergency room visit, a decade of debt. The system had not failed. It had pivoted. 4 mechanisms. Each one is specific. 1. The charge master. Every hospital maintains a price list called the charge description master, the charge master, for every billable item. In practice, it contains prices several times the actual cost of care. Insurance companies negotiate their rates down 60 to 70% below the listed price. The people who pay the full charge master rate are the uninsured, on average 4 times the actual cost of the same care. The people least able to pay are charged the most. 2. The deductible trap. Zara's $2,000 deductible is standard. For a family living without a financial buffer, as we explored in episodes 2 and 5, one emergency room visit consumes months of savings. No savings means the bill goes unpaid. Unpaid means collections. 3. The credit score weapon. Medical debt has been one of the most damaging inputs to the Fair Isaac Corporation score, the FICO score. The Consumer Financial Protection Bureau's own research found that medical debt has little predictive value for whether someone will repay their other debts. It does not measure risk, it records an emergency. Despite this, it has damaged the credit scores of millions of Americans. The rule to fix it was vacated in 2025. 4. The hospital-to-lender pipeline. Hospitals are now pushing patients directly into medical credit cards and financing plans at interest rates that can reach 29% to lenders with revenue-sharing arrangements with the hospital. The debt collection industry, fed by hospitals including nonprofits, granted tax breaks to serve their communities, selling patient debt in private deals to collection companies. For-profit hospital systems. Hospitals recorded their most profitable year on record in 2019, an aggregate profit margin of 7.6% according to the Federal Medicare Payment Advisory Committee. And the political architecture. 10 states still refuse to expand Medicaid under the Affordable Care Act. Medicaid expansion is the single most evidence-backed intervention for reducing medical debt. Those states made a choice. Their residents pay for it in bills. The One Big Beautiful Bill Act from Episode 7 cut Medicaid by over $1 trillion. The Congressional Budget Office projects 10.9 million Americans will lose health coverage as a result. 10.9 million more people facing the full charge-master rate in an emergency room. 3 months later, a letter arrives. Not from the hospital, from a company name she does not recognize, followed by the word associates. A debt collection agency. The hospital sold her unpaid balance. The amount is higher than she remembers. There is interest. There are fees. If she does not respond within 30 days, the debt will be reported to credit agencies. Her daughter is at the kitchen table doing homework. The arm healed in 3 weeks. She barely mentioned it after the first week. Zara sits on the stairs with the letter. The hospital sold her bill to a company that paid pennies for the right to collect it. That company is now chasing her for the full amount. If she ignores it, her credit score takes the hit, the same score that already reflects years of navigating without a buffer. She paid what she could. She went because her daughter's arm might have been broken. She did not choose any of this. She reads the dispute instructions at the bottom. Small print. She will need to call during work hours, with the medical records in front of her. Another thing to carry. Another Tuesday night. Medical debt at American scale is not natural. It is the result of specific policy decisions that other countries made differently. In 11 high-income countries studied by the Commonwealth Fund, an American healthcare research organization, 44% of Americans reported out-of-pocket medical costs over $1,000 in the previous year. In Germany, 16%. France, 10%. Britain, 7%. Germany strictly limits what patients pay at the point of care. Britain funds care through general taxation. These are choices. And inside America, the evidence that this can change is already here. Medicaid expansion. States that expanded Medicaid under the Affordable Care Act saw immediate drops in uninsured emergency room visits and medical bankruptcy rates. The federal government covers 90% of the cost. 10 states refused. That refusal is a choice that can be reversed. State debt relief programs. North Carolina required hospitals to provide charity care in exchange for enhanced Medicaid reimbursements. By October 2025, more than 2.5 million North Carolinians had over $6.5 billion in medical debt relieved. Vermont passed its Medical Debt Relief Act unanimously in May 2025. $1 million invested, $100 million in debt erased. These programs are running right now. Undo medical debt.
formerly called RIP medical debt, founded in 2014 by two former debt collection executives who changed their minds. They buy uncollectible medical debt portfolios for pennies on the dollar and forgive them entirely. $1 donated relieves $100 of debt. As of February 2026, $25.4 billion forgiven for 15.2 million people. Their founders describe it as sweeping up after the parade. The parade should not exist. Remove medical debt from credit reports. The federal rule was vacated. 15 states have passed their own protections. The major credit agencies have voluntarily removed most debts under $250. Partial, but the principle is established. Illness is not a credit risk.
The No Surprises Act and what comes next. The 2022 law made most surprise billing illegal. The private equity emergency room billing model is now largely prohibited, but ground ambulance billing, some of the most extreme surprise bills in American healthcare, remains completely unregulated. Bipartisan legislation to fix it is currently in Congress. A federal mandate requiring nonprofit hospitals to screen patients for charity care before billing is the next specific step. Zara went to the hospital because her daughter's arm might have been broken. That is the whole reason. She made a parental decision. The system responded with a product, a bill that grew while she was paying it, sold to a company that paid pennies for the right to pursue her, threatening the credit score that determines whether she can rent a home or access affordable credit. The chargemaster charges the uninsured 4 times what insurers pay. The deductible shifts risk onto the people least equipped to bear it. The medical lender charges 29% on a debt nobody chose. The rule that would have protected 15 million people was killed because debt collectors sued and the government stepped aside. Every piece of this was a decision. 8 episodes. The inheritance gap, built in 1944. The credit trap, engineered in 1978. The debt machine, running at record scale. The tariff charging you more the less you have. And now the medical system that extracts the most when you are most vulnerable. None of it is a force of nature. All of it was built. Germany made a different choice. North Carolina made a different choice. Vermont made a different choice on a unanimous vote with $1 million that erased $100 million in debt. These choices are available. Some people are already making them. Zara's daughter's arm healed in 3 weeks. The bill is still here. That is not a law of nature. Now you know who designed it. If you watched this episode all the way to the end, you are exactly who this channel is built for. Subscribe, not because you enjoyed the video, because the next mechanism we expose is already running, and you should know what it is before it finds you. Broke by design. Every week, new episode. The system does not explain itself. We do.